Beginning this Tuesday, Colombia's capital is going back to a life with minimal restrictions. The decision to reopen the city was made by Bogotá's mayor. Claudia Lopez explained in a lengthy press conference that unemployment and poverty had a lot to do with the decision. Health concerns were at the center of maintaining lockdowns and restrictive measures for more than a year. But now social issues are forcing officials to change their strategy.
We are restarting the majority of our activities so that the mental health of our citizens, which has been greatly affected by this pandemic, not just the physical, can also be addressed, so we can respond to the social and economic demands being made on the streets.
What's changing? Night curfews and bans on the sale of alcohol will be lifted. Bars and pubs can now stay open until 1 a.m. and schools, nurseries, and universities can fully reopen when staff get fully vaccinated. Clubs will remain closed and massive events are still banned. The local government insists that the reopening needs to go hand in hand with personal care, biosecurity measures, and vaccination. Face masks are still a must, and theaters and malls will still have caps on occupancy rates. Meanwhile, Colombia's national government is also approving the reopening of large events. The country's health minister said concerts and sports matches will be allowed with audiences capped at 25% occupancy.
I think the opening is good because we have really been hit hard in the commerce sector.
We are celebrating that we finally have public. I think health is more important than the economy, because if the health is destroyed for Colombians, they won't be able to create opportunities.
The decision to reopen comes during a critical time in the country's fight against COVID. All three of Colombia's major cities, Bogotá, Cali, and Medellin, have occupancy rates in intensive care units above 96%. Michelle Begue, CGTN, Bogotá.